Assalamualaikum everyone, welcome back to this channel. This is me Ali Wahid and you are on the channel of Medicare. So in this video we are going to start about the angina pectoris. So this is the first chapter which we are starting from the cardiovascular system. So in this chapter we will discuss the anti-anginal drugs. So before discussing these drugs, first we will discuss what is a angina pectoris. So let's define it, discuss its types, and explain all of these type in that lecture. So first we will see what is mean by both of these terms. So first of all, the word angina is came from a Greek word which is the angira. And angira word mean to block something. And pectoris is again derived from a word which is called as pectus, and pectus means the chest. Means something is present which block the chest. And this term is called as angina pectoris. Definition of it is that it is a medical condition which is characterized by the chest pain caused by poor oxygen supply to your heart muscles or increase in the oxygen demand from your heart. So this is called as angina pectoris. You can call this as the heart attack. So in the heart attack, your chest pain is occur. Why? Because your heart muscles, your cardiac muscles is not getting oxygen, is not getting the blood, because oxygen is present in your blood and your heart is not getting proper amount of oxygenated blood. So therefore your heart will increase the oxygen demands and allow the person to increase its oxygen. But because it is the heart attack situation, so the person who already have heart attack cannot get the required amount of oxygen. So that's why his muscles became die and the heart attack will happen. So what is the simple symptoms of that disease? So pressurized chest pain will feel out, and gradually this chest pain radiates into the left arm, into the neck, back, into your shoulders and your jaws. So these are some positions in which this pain can radiate out. So in that muscle cardiac muscle atrophy will happen. Atrophy means thickness. So the muscles of your heart will begin to thick themselves. And the next symptom is the edema. Edema means a decrease in the blood supply. So because the muscles are now very thickened, so due to increase in their size, the blood cannot flow to every part of that muscle, and which leads to edema. And edema will help, or due to decrease in the blood flow, two kinds of chemicals release. Adenosine, this is a natural protein which present in your blood, and second is bradykinin. These two release and they react with the central symptomatic nervous system nerve endings, and causing increase in the pain in the left side of your chest mainly. So that's why the pain feel in the left arm mostly, not in the right arm. So let's discuss some factors which can increase the risk of heart attack. So first is the lack of physical activity. Second is high blood pressure, mean hypertension. Then diabetes. Then this lymphemia, mean very high amount of lipid present in your inside your body. And smoking can also cause it, because due to smoking your lungs will destroy out, and due to your lungs improper function, the your proper amount of oxygen cannot supply to your heart. So that's why smoking can be a factor which can lead to a heart attack. So now we have discussed the first introduction of about it. Now we will discuss some types of it. So here are some types of angina pectoris. It has three types. First is stable angina, second is unstable angina, and third is Prince metal angina. So first discuss the stable angina. This is the most common type of angina which occurs in mostly people. So what happens due to it? It occur during the physical activity or stress. So consider a patient who is in some kind of physical activity, like he is doing some exercise and he is in stress. So in both of these conditions, he feels the chest pain. And why he feels the chest pain, we will discuss whole pathophysiology of it. But when this person go in the rest position, means he stop his exercise, he stop taking emotionally stressing out, then after the rest all the symptoms of chest pain will vanish out. So this type of angina or this type of heart attack is called as stable angina, in which only the pain happens when you are doing some exercise or when you are in stress. Whenever the patient will go in the rest position, the pain vanishes. So now what are the causes of it? So it has two causes, primary cause and the secondary cause. Primary cause is atherosclerosis. The word athero means artery, and sclerosis mean here always the sclerosis word mean hardening, but here I have explained it as a blockage, mean some kind of plaque is formed inside your artery. So you know that like this is your simple an artery, but in that artery if some kind of plaque is formed, now the blood cannot properly flow out as it does. So if the plaque is formed inside your coronary artery, what is coronary artery? It is an artery which supply blood to your heart muscles. So you know that your heart is pumping blood into whole your body, but your heart also needs some blood, some oxygen. Your heart also need oxygenated blood. So therefore coronary artery is an artery which very important role in supplying blood to your heart itself. So that's why if the plaque is formed in the coronary artery, like suppose this artery is a coronary artery and the plaque is formed inside it, then you can have stable angina. So if the person is in the exercising activity, and now due to exercise he needs more and more oxygen, so the blood should be more and more flow from it, but due to formation of plaque now the blood cannot uh, reach to the heart or cannot supply to the heart muscles, therefore the pain occur, because most of the muscle cells cannot get oxygen and they will cause the pain. And the second cause of this stable angina is the atherosclerosis. Both of these terms are different. Atherosclerosis is the type of arteriosclerosis. Arterio word mean again artery and sclerosis mean hardening. Now due to the formation of plaque inside your artery will harden out. Now this plaque is fixing itself and making the artery hard or thicken. So therefore now its diameter decreases and very less amount of blood can pass through it. So this arteriosclerosis leads to an unstable angina or other things or other kind of heart attack. So now let's discuss the pathophysiology, that how this plaque is formed inside your body. So, first step is the formation of plaque. So, how this plaque is formed, its composition or its how it is formed due to smoking, because due to smoking, it can also cause the hardening or thickening of your yeah, arteries. Second is high level of cholesterol present in your body. So, how the cholesterol is formed due to taking of low density lipids. So low density lipids, they are very harmful for your body. There are three types of lipids: high density lipids, low density lipids, and very low density lipids. So the high density lipids are very healthy for your body and they are playing important role, and all of these kind of lipids, high density lipids, are present in the fruits and vegetables. But the low density lipids, they are not beneficial for your body. They increase the cholesterol level and they will cause the formation of plaque inside your arteries. Not necessary it form in the coronary artery, it can form plaque in other arteries of your body. But today we are discussing about the angina, mean the heart attack, so we are only discussing a artery which supply blood to heart, which is the coronary artery. So after the formation of plaque, what happens? The damage of epithelium will happen. Now you know that in the layers of your artery the epithelium is present. Due to the formation of this plaque, this epithelium layer will begin to damage itself. It's lost the permeability and allow lipids and various low density lipids or cholesterol to move inside your epithelium cells. which make the condition more worse. So now, after the moving of low density lipids inside your epithelium cells of your artery, it oxidizes. How? So low density lipids are oxidized by the presence of oxygen reacting species. Means some kind of free radicals are present inside your artery which will oxidize these lipids and produce oxidized low density lipids, and these oxidized low density lipids, they increase the inflammatory response. Now what is mean by increase in the inflammatory response? It's mean that your oxidized low density lipid, they will attract monocytes and various kind of inflammatory cells, eosinophil, basophil, neutrophils toward themselves. So you know that monocytes, after the entering into the tissue, they swell, and after the swelling they are called as macrophages. The macrophages will go phagocytosis, it goes, and phagocytosis the abnormal cells which are present, and after it will form a cell which is called as foam cell release mediators like insulin like growth factors, lipid, protein. All of these mediators enter into the tunica media mean the layer of muscular tissue present in the artery. Increase in the proliferation mean increase in the number of cells of muscles, causing the migration of smooth muscle cells into the tunica intima. And last step is the plaque maturation. Now your plaque will increase its size and become mature. How? And this plaque is also called atheroma. Okay. So now these muscle cells release collagen, because collagen and elastin, these are some kind of proteins which are naturally present in the muscle cell. So muscle cell will release them. Some kind of protein and dead cell are also released, and due to the accumulation of all of these things, your plaque increase its size. So here I have explained all of this pathophysiology with the diagram. So this is your normal artery, and this is the artery of a person who has angina, stable angina. So you can see this artery is blocked due to the formation of this plaque. Now only this area is free for the blood passage. So 60 to 70% of artery is blocked. So now these are the layers of your artery. First layer is tunica intima, tunica media, and tunica externa, which can also be called as tunica adventitia. So this is the innermost layer, this is the middle layer, and this is the outermost layer. So the innermost layer, it consists of epithelium cells. So now these epithelium cells will damage out because of the formation of any kind of small plaque. Now, this small plaque will increase its size and damage the epithelium, which cause the low density lipids to move inside. They will oxidize and attract the inflammatory cells. These are the inflammatory cells, basophils, eosinophils, neutrophils. It will attract these cells toward itself, forming a foam cell. Foam cell release insulin or insulin like growth factor, which increase the muscle proliferation. Muscle cells will release collagen and elasticin and migrate into the tunica adventitia, or you can say tunica media. Okay, then the plaque will form. So it's not moving here, it's moving again the upward. So you can say here muscle cell will release them, and after that the plaque will form here. Now this plaque increase its size more bigger. So this was all about the pathophysiology, that how the angina pectoris or the heart attack occurs in a patient. So now let's discuss the other things about it. So now the next concept is about hypertrophic cardiomyopathy. So why I am writing this? Because it has some kind of similarity with the stable angina. What is this similarity? Let's discuss that. What is mean by hypertrophic? Hypertrophic mean increase in the muscle size, and cardiomyopathy mean, cardio mean heart and myopathy mean muscle, mean हार्ट के मसल्स की साइज में इंक्रीज होना. So its definition is it's caused the abnormal thickening of heart muscles, particularly muscles of left ventricle. And you know the left ventricle is the most important component or most important compartment of your heart. So now its muscles will begin to thicken itself. So if I am drawing the left ventricle of your heart, so it is something like that. Okay, so I have only draw the lower part of your heart. This is something like this. So normally this thickness is very low as I have draw here, but the person who has hypertrophic cardiomyopathy, his muscular strength will increase out. So his muscles will be like that as I am drawing here. So, as you can see now, his muscles are abnormally thickened itself. What are the symptoms? Is caused chest pain during the physical activity, as we have say in the stable angina. So this is the similarity between them. That in the stable angina, the pain is happening when the patient is in the stress or in the physical activity. Similarly, the patient who have hypertrophic cardiomyopathy, he feels chest pain during the physical activity. So this symptom is similar between both of them. Now let's discuss the second type of angina pectoris, and this type is called as unstable angina. So this is nothing, this is just similar to stable angina, but now the condition is more worsened. Now the blockage is more than 70%. So in the stable angina there is only 60 to 70% block, but in case of unstable angina, now your artery is more than 70%. So as you can see, now the space for the blood flow is even less. So it have a chance to reverse, but the patient will need to take the medicine in his whole life. So causes, it's caused the increase in the size of erythema. As you can see here, now the erythema or the plaque increase its size, it become more hardened, and the endothelial will rupture, which cause the blood clot, which cause a thrombus formation, and due to thrombus the blood flow will decrease out, the edema will happens, and the heart this heart attack will happens. And it cause pain at the rest or at the exercise. So when the patient is at the rest, he also feel the pains. Because why? Now your the size of erythema is so big that at the rest condition the patient cannot getting the proper amount of oxygen. But in case of stable angina, the blockage is not so much that the patient cannot get the oxygen at the rest state. At the rest state, the patient is getting the oxygen, but now due to more than 70% of the blockage, patient is not getting the oxygen, and so he also feel the pains at the rest state. And this is a severe emergency situation, and the patient who have this angina will have to visit the hospital, and the doctor will give him emergency medicines to that patient. So in it the muscle cells are alive, so but it leads to myocardial infarction. So this is another important term, myocardial infarction or angina pectoris, they are not the same thing. Actually your unstable angina, in unstable angina the muscle cells are alive, but when you proceed to myocardial infarction your muscle cells are dead. So now to reverse or to treat the myocardial infarction permanently or completely is not possible, because now your muscle cells are die and we cannot make them alive. Okay, so this was all about the unstable angina. Let's discuss the third type of angina, which is mental metal angina. So it has three names. First is variant angina and vasospastic angina. So now the chest pain will occur at the exercise as well as at the rest state. So it's one thing is similar to unstable angina, but it has a chance to reverse, but it causes transmural edema. Transmural edema means this, that the artery is going to completely or a block. Okay, so this artery is completely causing the edema or poor blood flow, and transmurally it is cutted itself. So it can occur due to the formation of plaque or cannot be occur, and it can occur in any layer of your artery. Causes: it caused due to sudden vasoconstriction in your coronary artery by the local vasoconstrictor, and this local vasoconstrictor is the thromboxane A2. So now let's discuss about the arteriosinosis. So aortic stenosis mean aortic mean aorta, and stenosis mean blockage. So now the blood flow from the left ventricle into your whole body is decreased out. So because the aorta is blocking out, and aorta has to send the blood from your left ventricle into your whole body. So if the aorta is blocked, it cannot sending the proper flow of blood into your body. So the muscles of your left ventricle will thicken itself, will try hard and hard to send all of the blood, but it cannot. So this condition is called as aortic stenosis. Aortic stenosis is just a different concept. It's not included in the angina pectoris. Just I have written it in order to give a concept to you. So this was all about the today's lecture. I hope that you will understand it. If you like this video, then please subscribe to my channel, like my videos, and if you want to get more videos on that topic, then please subscribe to that channel and visit to my channel. You will get all of these videos. Thank you so much. Meet you soon in the next lecture. Allah Hafiz.